During 9 months in the womb, the fetus lives in a perfectly sterile environment. His digestive tract is therefore clean of all bacteria. However, at birth, the strength of your baby's immune system will depend on the type of delivery. Let's see what happens when a child is born naturally. During birth, the baby comes in contact with different bacteria from the mother's vaginal and fecal flora. By ingesting these substances, the baby's digestive tract feeds and strengthens on the mother's bacteria, including those necessary to the development of natural defenses. Indeed, 80% of the immune system is located in the intestines, and natural birth enables the baby's defense system to be operational more rapidly. On the other hand, during a cesarean birth, the baby comes in contact with a very limited amount of bacteria, mostly those present in the operating room. His intestines are less colonized, less protected. This delays the stimulation of the immune system and increases risks of allergies and intestinal infection. So what can be done? The best solution is breast milk, as it naturally strengthens your baby's immune system. It contains the good bacteria necessary to the colonization of the intestinal flora. If your baby is not breastfed, your pediatrician can recommend a specific infant formula. In the digestive system, probiotics attach to mucous membranes. In sufficient quantities, they form a first line of protection that prevents viruses and germs from passing through the intestinal wall. This way, the defense system of your baby is strengthened. Ask your pediatrician about it. Your baby is healthy. Weight gain is steady. However, he or she spits out a little milk after meals. Your pediatrician has diagnosed regurgitation. Don't worry, about 4 in 10 babies have this little problem. The liquid spat out may look like the milk just drunk, or like cottage cheese. Several things may cause these regurgitations: too much milk, drinking too fast, or too much movement after the meal. But let's see what happens in a baby's digestive system. The infant formula drunk passes through the esophagus. There, what we call the bolus reaches the stomach. The stomach is like a bag. When it fills up, its walls distend, and the pressure created by the volume narrows the junction between the esophagus and the stomach. This junction is called the cardia. Very often in babies, the muscles around the cardia have not yet reached full growth. This is why they do not stop the bolus from going back up into the esophagus. Your baby spits out. It is frequent, but not alarming. How can it be relieved? If your child is not breastfed, thickening the formula with starch will help reduce the spitting out. This way, as the bolus is more compact in the stomach, it is less likely to transfer back up into the esophagus. In addition, the predigestion of milk proteins helps the bolus move more rapidly from the stomach to the intestine. So your baby has less regurgitation, is more relaxed, and benefits fully from a healthy diet. Ask your pediatrician. You, your spouse, or one of your children is prone to allergies. For this reason, your pediatrician has warned you that your baby may also develop them. We say your child is a high-risk allergy baby or an atopic baby. Allergies are an overreaction of the immune system to proteins that appear to it as dangerous. These substances are called allergens. They are normally harmless, except to the allergic person. The milk your baby drinks contains, among other things, proteins. The first time a high-risk allergy baby comes in contact with an allergen, the latter is tolerated. It is broken down by enzymes the regular way. However, although the allergen is able to pass through the intestinal wall, the body may also develop antibodies. The first phase is called sensitization and does not trigger any allergy symptoms. It is with the second contact with the protein that the sensitized baby's defense system reacts. The antibodies try to eliminate the allergens that they consider wrongly as enemies. This reaction causes allergy symptoms such as eczema, asthma, rhinitis, or diarrhea. What are the solutions? Breast milk is the best for high-risk allergy babies. However, if your child is not breastfed, a hypoallergenic baby formula from birth is recommended in order to avoid the first sensitization phase. This type of milk contains modified milk proteins, which allow the body to accept them better. This way, proteins are well assimilated by your child, who can develop normally. The modification of proteins in specific hypoallergenic formulas reduces the risk of allergy to milk proteins. Ask your pediatrician about it.
Don't worry, sleep.